Hi there, this is Lisa, patient representative.
Hi, my name is Joshua Taylor.
Oh, hi, Joshua. Yeah, we spoke briefly, super briefly yesterday.
Okay, that
Or,
was you. Yeah, I'm
yeah, that was
sorry.
yesterday. Yeah.
I didn't mean to hit the three-way. I was trying to go back to them and get the case number quick and come back to you.
Oh, okay.
Um, yeah. So, um, there is a lot of violations on the medical staff that is dealing with my friend's care, both ethically and legally.
You said both what?
Ethically and legally.
Oh, okay.
Um, it's kind of been continuous since he's been in there. I mean, um, I guess most recently, uh, so I don't even know where to start. um, so I've had issues all along with care team trying to voice my concerns of medical issues like subluxation of the shoulder, edema in the hand, and saying that there's absolutely no evidence of either of those. Like the edema, that's a pretty easy one. Like the shoulder, you can see a little divot. He's definitely like leaning that side. Nobody was telling him to like prop his hand up. Weren't taking care of that in the beginning. Weren't addressing that he has a flaccid hand, and that can cause subluxation. I was told I'm not a professional. They don't have
Shoulder? You said shoulder subluxation?
subluxation. Yeah.
Uh-huh.
I was told that I wasn't a professional by the first practitioner that I talked to, and that he didn't have to listen to me. I talked to occupational therapy about it, in which I was treated the same way, and the lady actually said to me, "Well, I have my master's," and then giggled. Um, when all I was trying to do is get them to acknowledge the subluxation and use K tape to keep the subluxation um, supported. Um, they said there was no subluxation, and then a week later, they're talking about subluxation in the chart, but they were using uh, shoulder sling. They were trying to treat it with a shoulder sling, which is highly unadvised for stroke patients because it promotes non-use of the affected arm. Then that's why K tape is recommended, because it doesn't prohibit use of that arm.
So, and you've talked with the providers about all of this,
Mhm.
right?
Yep.
Okay.
Well, then I noticed in the charts another practitioner was talking about, because we've been waiting for him to. He's supposed to get transferred into new housing before this happened, through the Colorado
Mhm.
Coalition for the Homeless, and that has been the holdup on his discharge, getting him into his new place. But in the in the meantime of that, um, sorry, I just broke my train of thought. Um, so the one practitioner wrote in the hospital charts that um, David is waiting for his place, that he would need assistance to be able to live at home again, and that his friend Josh, that is me, was volunteering to be his in-home caretaker. And then they wrote in there that um, we believe that Josh is living with the patient and that he has secondary gains for taking the patient home. That's straight up defamation. That's libel.
Well, sir,
Since they wrote.
okay, so what is it you actually need help with? I mean, we can't change what they wrote or what their medical opinion is or what the care plan is. So what can we help with?
Um, I'm
And it looks
just
and it
getting
looks as though
started.
the
Yeah.
manager, they've got some guidelines here for communication. Looks like they've talked about that, and they'll give updates Monday and Friday at 3.
They illegally kicked me out of the hospital for one. They called me on the phone to tell me that I am not allowed to go visit David anymore. That is a direct violation of due process.
Well, okay, what if they let you go and said you can't be here? Looks like your visitation rights were revoked because of threatening behaviors towards staff, providers, and the social worker.
I never made threatening. I never made threatening.
Nope.
I never once made
that's
threatening.
not, well,
Also, that's not the
okay.
correct procedure. Are you an advocate or are you on their side?
We work for University Hospital.
Correct, but you're a patient advocate. You're there to advocate for the patient. You're not there to side. You're not there to side biasly with the hospital. So, in the procedure of telling somebody that they're not in,
what we do is send issues over to the manager, and the manager looks like they've updated some information for us and did let us know that they did revoke the visitation rights due to threatening behavior. That's something that we cannot assist with, and they are certainly well within their right to do that. And then it looks as though from the manager they'll be doing updates Monday and Friday at 3.
I never once made any threatening behaviors towards them.
Okay,
they called me. The practitioner called me on his phone, causing a HIPAA violation. He called me on his phone in his car. That's a direct HIPAA violation. You're not allowed to call in public to discuss medical details about somebody.
Okay, so what else can we help with?
So, as I was stating, they illegally told me it's an illegal process for them to call me on the phone and tell me that I'm not allowed in the hospital. I actually requested them. I said, well, what is the reason? They said, we don't have to tell you the reason. I said, yes, you do. This all has to be in writing, and you also have to include the appeal process. You can't just call somebody on the phone and tell them that they're not allowed in the hospital. That's not the legal way to do it. That actually is a complete violation. No, that it's not. It's a complete violation of due process. My advisors have told me that. Like, I have a huge legal team behind me. Like, so I'm trying to work with you because you're an advocate, because you're the advocate and you're supposed to be the middle ground between what's going on. You're supposed to advocate for the patient's care. If you are ignoring my complaints, then you are also in violation then. No, he's not. They cut off physical therapy. They cut off physical therapy 3 weeks ago. They cut off occupational therapy.
Let's talk about what his care issues are here. So you said they cut off physical therapy. And what else is going on with him where they cut off physical therapy?
So their explanation for cutting off physical therapy was that he has now excellent movement, and they think that he has plateaued and is not going to improve anymore. It's 2 months into a stroke. He doesn't have excellent movement. He was just starting to be able to even move his shoulder and his elbow. He has major edema in his hand. His stroke hand is swollen to twice the size of his good hand. The practitioner Ellery that I talked to said that she was just in there and observed him and didn't observe any edema whatsoever. But his hand is literally twice the size of his good hand. That's very, very obvious that edema is going on. I mean, they ignored shoulder subluxation in the beginning, and then a week after I'm telling them about shoulder subluxation, then they have it in the charts for shoulder subluxation. Like, there's been multiple, they say that his cognitive level is that of a vegetable pretty much, yet I have substantial evidence that shows that he has a very high cognitive level. Just because he has aphasia doesn't mean that his cognitive level is affected. That just means his speech is affected. Like, aphasia doesn't mean that there's been a mental deficit. Like, that's just a speech deficit. And they're treating it like a mental deficit. Now they're trying to revoke power of attorney because of that. and again, they're not following the proper legal proceedings to revoke power of attorney for that. So their claim that power of attorney is not legally upstanding, just like their claim that I'm not allowed in the hospital, is not legally upstanding until they actually put that in writing and tell me the exact reasons why and give me the appeal process for that. Same with the POA. Like, they have to legally proceed that through court, where I have due process to represent against that I have to argue against their analysis of his cognitive state. Like, I've asked the caseworker before I did the POA. I said, will you please go do a reassessment, because nobody else will do a reassessment. She said, I'll go in there Monday through Friday each day and talk to him, and then I'll get back to you that Friday and tell you what's up. Never got back a hold of me. So I went in. I'd talked to David multiple times on the phone explaining what the POA was, what exactly that outlines. He was agreeing to that all along. Like, I have him in video agreeing to that. I then went in with the notary. The notary went through all of the paperwork with him, confirmed that he was cognitive enough to sign the paperwork. Otherwise, she would not have done it. Like, there's multiple violations here, and definitely need to get to the bottom of it. I don't know if I have to talk to your ethics board then, or if there's other avenues that within the hospital that I can take that you can refer me to. But yeah, I don't know what your opinion of this is as an advocate.
Well, as a patient representative, sir.
Representative.
Advocate
patient.
Implies that we're going to just do anything and everything, regardless of what the parameters and boundaries are within UC Health, and that's not feasible. So what we will do from our end right now is definitely reach out to the nurse manager about this. You said that they cut off his PT. They said he had excellent movement and plateaued. You disagree with that. You said they're trying to revoke POA and they're not following the proper, as you said, legal terms and, quote, due process for that. And you said that because they're supposed to put that in writing and give you an appeal process, and they didn't do any of those things. So what we would need to do is give this over to the nurse manager. They can review this situation with the treatment team and then reply back to you. Okay?
Okay.
That is what we can do.
He needs a new cognitive assessment. I've sent.
I have that. You said that he needed another reassessment, and you asked the caseworker for that.
Yeah, and I just sent her the video. I just sent her the video also that I have recorded of him showing his cognitive state. Yeah, and that edema needs majorly addressed, because that's hindering his ability to cooperate with physical therapy or try to use the hand on his own. Also, they cut off occupational therapy. They had said they were continuing with those services, and then literally the next day they cut off that service after assuring me that he was going to still get those services.
Okay. Anything else? I've got that noted also. Anything else?
Let me think exactly. I mean, the doctor calling me on his in his car being a HIPAA violation. What else? And they're also blocking the process of him getting transferred into his new apartment so that he can get released.
I've got that down.
From the hospital.
You shared that. They said, you told me that note said that that Josh has secondary gains. No, I've got notation of that too.
Well, that also, but they're also
I have that.
They're also interfering with the coalition's process. Like, I'm trying to do application update with the coalition so that he can get into the apartment that he's supposed to be going into, because his application expired. and now the hospital has blocked that process, told the coalition not to proceed, even though that's supposed to be part of his uh, discharge care plan. And then also,
Mhm.
uh,
Okay.
and then let me think quick. The he was supposed to go into acute rehab for 10 days between the hospital and going home,
Mhm.
and now they're saying that acute rehab wouldn't benefit him, when in no way should they be saying that about a stroke patient that's only 2 months into recovery, and knowing that neuroplasticity is very important at this time. That's why they shouldn't have cut off physical therapy or occupational therapy either. Even if the patient
Mhm.
plateaus, they should proceed. They've also given David the options of denying physical therapy or occupational therapy, music therapy, or anything
Yeah,
like
he can
that.
do that.
Uh,
Did he deny it?
then why are they able to say that he's not at a
Did he deny it?
They said that
Did he?
yes, he did deny a couple
Oh.
sessions, and that's the thing though, is they're saying that he's not at the cognitive level to make decisions like POA paperwork, but they're giving him
Mhm.
the ability to make decisions whether or not to turn down his therapy. Like, that's contradictive in itself. And then also from April 14th to April 24th, physical therapy wasn't even seeing him. They hadn't seen him for over 10 days, which was stated in the
Mhm.
medical charts. And that was in the first couple weeks of his stroke recovery. That's like the most important time. Like, and they're saying that they're giving timely and consistent therapies, and that's totally contradictive to missing 10 days in a row. Like, there's and then he's only getting this therapy for maybe 5-10 minutes a day once a week, and then they're complaining about carryover, that he's not having carryover between sessions. Well, they're giving him very, very, very short sessions, and very sporadically, randomly, and very stretched out, when they originally had told me that he was going to be getting that care 5 days a week.
Okay. So they originally said that he'd have therapy 5 days a week, but it's shorter. Okay.
Yeah, and at one point they actually missed 10 days in a row at the beginning of his therapy, which is very, very important. Whether he has aphasia or not, whether he can say things or not, that doesn't mean that
How many sessions was it? 5 sessions missed?
Oh no, it was over 10 days worth of
Okay. 10
therapy
days.
missed. From
Okay.
notes, or in the charts on April 24th, it said patient hadn't been seen for over 10 days, so restarting.
Why?
No statement.
What was the reason?
No statement on the reason.
Okay. All right. I've got that down. Anything else that I need to let the nurse manager know?
I believe that's it. And what is the follow through process with this?
As I shared, we'll send this to the nurse manager. They'll have to take a look at the concerns that you've provided. They'll work with the treatment team and respond back to you. Okay?
Okay, and you have my email?
We have your phone number. That's a call.
Okay, could I have them email me?
Okay? I can take the email. I don't know if they will, but I'll take your email. What is it?
Taylor Shades, TaylorShades @gmail.com.
Mm-hmm. Okay, got
And
that
then
noted.
if they are going to call, I just request that they call afternoon, because I work second and third shifts, so I don't normally get to sleep until about sunrise.
Okay, got that noted. All right, so you got your email, and then call in the afternoon if that's what they're going to do. Okay. All right, I've got that.
Okay.
So let me, I need to get this over there to the nurse manager right away as soon as we're off the phone, and make sure that they have all of the concerns, and then they can review and respond accordingly. All right?
Yeah. And do you have any insight on how to pursue second opinion?
That's provider driven. So that's a conversation with the treatment team.
Okay.
Okay?
All right. Well, thank you. I'm going to continue with my calls of other oversight.
Okay. All right. Thanks for calling me back. Take care.
Yep. Thank you. Bye bye.
Bye bye.